This is for number 3. This is for number 3. So health sector improvement starts first from the top. The federal and state governments and the National Assembly and State House of Assemblies, all the ministries, departments, and agencies that have to do with healthcare must first understand that when you look at the Sustainable Development Goals, okay, there are 17 of them, that healthcare is number 3, that healthcare is extremely important, and that we must put all the necessary resources to healthcare is a mainstream public good. You cannot develop an economy, a country, without sorting out your healthcare system. And so it starts from there. Of course, all the key players, starting from all the professional health organizations, the faith-based organizations, civil society organizations, the media. The media is so important. The media must mainstream healthcare. They must set the agenda to actually let people know that healthcare is extremely important. What I want to see is that now that the politicians are talking about 2027, I want all the cadres of human beings in this country, in Nigeria, to be asking the politicians, what are you going to do about our healthcare system? Our healthcare system is weak. Our healthcare system is broken. We need to fix it, and that will first of all start from leadership. Okay, and leadership, well, like I said, I'm calling them more office holders. We want them to be leaders. When you talk about national conscience culture and you talk about organizational culture, leaders must model, they must lead from the front. The followers and people, the citizens, actually take cues from their leaders in terms of how behavior, in terms of culture, ideals, and stuff like that. So once you actually have leaders and all the key players understanding that healthcare is important, then you can start having programs, interventions, funding, and a mindset that will actually push for a healthcare system that can actually benefit all Nigerians. And I mean all Nigerians, not just the middle class and people that stay within the cities. I mean even for rural dwellers as well, especially 2 key things: our primary healthcare system and, of course, our emergency care and service systems as well.